Good morning, everyone. I'm Dr. David Wild, Vice President of Performance Improvement, in again this morning for Dr. Steve Stites, our Chief Medical Officer. We're coming to you from the Dolph Simons Jr. Family Broadcast Studio. This morning, Marian Ramirez, Director of the Junto Center for Advancing Latino Health here at KU Medical Center, and Dr. Edward Ellerbeck, Chair of our Population Health Department, are our guests. We'll talk about great things coming out of a National Institutes of Health initiative. As the NIH continues to look for out-of-the-box ideas, we'll continue to share with you what we're thinking and how you can help. But first, as always, Doc Hawk, our Medical Director of Infection Prevention and Control, is here with our numbers. How are we looking today, Dana?
Still stable. 11 inpatient active admissions with 5 in the ICU, so almost half of those in the ICU. And then, of course, 1 on the ventilator, so that's good. 15 recovering, so 26 total. Hays has 1 active and 1 recovery as well.
So continued sort of
about
more of the same.
Yeah, we said in that 20 to 30 total patient range between active and recovery. Obviously, we would like lower than that, but I think this has been our steady state for right now, and we'll see how continued vaccination goes and opening up goes and lifting of restrictions. Take it one day at a time.
All right. Before we get into our conversation today, are there any reporter questions this morning?
I don't have any, and it would appear that they had other questions yesterday.
Wow.
Well, we'll see how long that lasts.
Yeah,
Cody
right,
will jump in here, I'm sure, soon. All right, well, let's start then with you, Dr. Ellerbeck. Good morning. Thanks for joining us. Tell us a little bit about the RadX Up initiative and what it supports.
Okay, well, sure. So first off, it is an NIH-sponsored initiative, as you talked about at the opening. And we should probably say, what does RadX stand for? So RadX is Rapid Acceleration of Diagnostics. And there's really 2 components to that rapid acceleration of diagnostics. One is on the technology platform. What kind of tests can we actually develop and put up? And so there are a bunch of researchers around the country who are currently working on different platforms for testing, such as how can we speed up the timing of getting results? How can we actually get portable platforms that can actually be used in the home or for communities or be used for mass testing approaches? But there's also the big concern that even if we have the best tests out there in the world, how do we actually get them to the communities most in need? And obviously, this is something you guys have been mentioning, messaging for a long time. And so we're specifically working on something called RadX Up. And the UP stands for underserved populations. And so it's about $500 million, I think, nationwide, being focused on working with academic centers, thinking not only about the scientific knowledge of how to bring these tests into the appropriate communities, but then also having that be pragmatic research, where while we're actually studying and learning, we're also doing very pragmatic work to make sure those at-risk communities are getting tested.
Can you share some examples of what that sort of pragmatic, outside the box thinking looks like in a community?
Okay, so I think the first thing is putting the community in charge. Okay, getting them more involved, and so it's one thing for us at a medical center like this to be talking about testing. It's another thing to be in communities that are particularly hard hit at the grassroots level, thinking about what are the fears, challenges, and needs that people have in getting testing. So in setting this up in Kansas, we specifically tried to identify some of the hardest hit areas in Kansas. And we identified 10 counties across the state, 4 urban, 6 rural. And I think if I tick off these names in our urban settings, we're looking at Wyandotte, Johnson, Sedgwick, and Douglas counties. And we've all heard about the epidemic in there. But particularly in the 6 rural, I think you'll be interested. We're talking about Lyon, Crawford, Saline, Riley, Finney, and Seward. And as I've talked about some of those, you know about the essential workers in those communities, particularly in the meat packing plants who have been particularly hard hit. You also know that there's lots of immigrant communities in those areas who might have reasons to distrust government type of programs, or there may just be communications issues. So in Kansas, we've been really focused on trying to get representatives from those at-risk communities to help us learn how we can best communicate and deal with those challenges. challenges. And frankly, Marian Ramirez, who is here with us today, has really been at the front lines level on that, talking about this both in Wyandotte and in Southwest Kansas.
We'll get to Mariana's experience here in just a second. One more question, though, before we do. How do we transition the learnings that you've talked about around engaging communities in testing to vaccinations? Because there's clearly a next step there. Testing is important, but there's also the same sort of level of importance around messaging of vaccination.
Okay, so first off, I think when we put these 10 counties together, we've put them together within the context of a learning collaborative. And so we're doing different things in each of these 10 counties, but we come together every other week and share our stories, best practices, and we learn from each other and hopefully translate the messages of what's learned best to other communities so they can rapidly adopt those things. Obviously, our testing initiative started in September right before the first wave and right before the vaccines came on, and now the vaccine clamor for vaccines is huge. And but our grassroots efforts on the ground, the community relations we've actually established, the communication strategies and messages are frankly really the same for whether we're talking about vaccinations or we're talking about testing approaches.
Great. So Mariana, thank you for joining us as well. Tell us a little bit about your role both in the RadX Up program, but also in the Juntos Center here at KU.
Sure, yes. So within the RadX Up, I work with Dr. Chen and Dr. Lumpkins, leading the communications core. Our RadX Up is organized in different teams, and within the communications team, we are committed to working with the different communities in the 10 counties to develop and disseminate messaging that really talks to the living experience of the communities we're working with, right? So we've been working with not only Latinos, but also African Americans, a lot of immigrants from African countries to develop this messaging. And we also have a strong group of community consultants that work with us on this process. And then within Juntos, I am the director, and we have been focused on developing messaging that is culturally appropriate, particularly Spanish messaging. At the beginning of the pandemic, in particular, there was a lack of information, of current information in Spanish. Sources like the CDC were lagging like a month in current information. Now it's gotten a lot better. A lot of reliable sites have information in multiple languages and for different populations. But because we started early on, we have developed within Juntos a strong network of communications, working with partners throughout the state to disseminate important messaging.
Great. Thanks for that effort. No doubt important, making sure that everyone has access to both real-time but also correct information. As we talk about what has changed over the pandemic, one of the other things we know is that early on, especially for populations that are hourly workers, there was not a lot of motivation to be tested because of the fear of time off work and unpaid time off work. Is that still an issue now? Has that changed at all?
It is still an issue. I don't have any research data, but anecdotally from what we're hearing from our community partners, it is still an issue. Things have changed a little bit in which as things have opened up, people are more engaged back in the community, and they have also learned to work things out. It also helps that more people are working, so homes are not depending on one sole individual. There are now other concerns. So we know that testing is low everywhere, and we're working hard to improve that. And it is a combination of reasons. And the same applies to the vaccine. There's this new wave of barriers that are making it a little bit harder to have the full buy-in for the vaccine. For example, we've been hearing a lot of myths about the safety or side effects of the vaccine. And we've been working hard with community stakeholders to combat those in a culturally appropriate way. So this is what we're seeing on screen is an example of the work that we've been doing. That's the Lorito campaign. Lorito is this little parrot. It's the cousin of the Jayhawk. And we get community questions from the community and we answer them in an appropriate way. So this one is particularly about the chip, right? The chip that is in the vaccine, and so that the government can control us. So we've been releasing a series of those materials since early on. That one on the screen is about the Guadalupe Reyes Marathon, which is something very common for Mexicans. We start celebrating the 12th of December, the day of the Guadalupe Virgin, and then we end in with the King's Day on January 6th. So that's a lot of celebration, and we were prompting to celebrate in a safety way. So those are some of the examples that we've been using.
I love the cousin of the Jayhawk. It's a great approach. You mentioned some of the other barriers that you're hearing now from the communities that you're engaging with and serving. What are some examples of the current barriers, either to testing or to vaccination?
Mm-hmm. Yeah, so I talked about misinformation, and that also includes information that is coming from other countries. A lot of us immigrants are very connected to our countries of origin too, and we have had information coming from our countries that is different from what we're hearing here. For example, the president of Venezuela talked about a miraculous treatment that could cure COVID. Then the president of Mexico said that because he had already gotten COVID, he no longer needed to wear his mask. So we get those types of messages. And then on the other end, we have here a population that, especially with the past administration, have been afraid of sharing information because it might be shared with immigration officials. So how can we trust that when we come and get tested, that when we come and get the vaccine, our information is going to be confidential and that it's not going to be shared with authorities like immigration officials? So those are some of the biggest concerns. I know that in Southwest Kansas, that are, and it happens everywhere, but this one, we received it from Southwest Kansas. People were concerned because some of them work with a different name. So they were concerned that if they got the vaccine, but at work they had a different name from their real name, what was going to happen then? They were going to get a card with proof of a vaccine, but not under their name. And then we also heard about some forms, some entrance forms to get the vaccine that had a lot of language about health insurance and financial responsibility. So having clarity and transparency on those communications is very important to have the buy-in of our communities.
You know, many of those issues that you're describing are challenges for access to healthcare in general, and especially important in the time of a public health emergency or pandemic. Mm-hmm. Clearly, a tall order for you and your team, really the entire RadX Up team, as you're trying to get the messaging out. One other thing I think might be important to talk about, I believe that you're engaging community health workers and others in this process as you engage different populations in different communities. Tell us a little bit about what a community health worker does in a role like that. How do they help a community improve their health?
They're amazing. So community health workers are trusted members of the communities they represent, and they have been since day one very engaged in COVID, helping at pop-up events, providing assistance with testing events, but also following up with those that are sick. and helping them get access to resources like food or rental assistance. So they have been key. And some of them have been also involved with case management and contact tracing. So because they're trusted members of the community and the community knows that they have been involved with COVID assistance, we are working with them now to develop a campaign where they share with the community their experience getting tested and getting vaccinated, and they prompt their communities to do the same, to care for each other.
You know, maybe this is a question for both you, Mariana, and Dr. Ellerbeck. As you look at what you have learned from this process so far, what needs to happen next to reduce the impact of COVID on these communities?
I think on our end, we would like to see clear, like statewide messaging, giving this confidence to people that the vaccine, it is safe, and that the information is going to be safe too. That the requirements for getting the vaccine is just to make sure they have the residents of the county where they're getting the vaccine, but that they do not need a government issued ID, and that the information is not going to be shared with anyone else. And that can only be accomplished with community buy-in. So working with grassroots organizations, working with the health action teams in the different counties, that is going to be key to bring both more testing and vaccination and COVID in our populations. We've been fortunate to have the leadership of the Kansas Hispanic and Latino American Affairs Commission. There is a strong group of Latinos throughout the state of Kansas who have been working together, a lot of grassroots efforts sharing this information. And I think one of the things we have discussed is having this like consistent message throughout the state where it is clear for everyone that they are safe coming up front and getting the vaccine, and that their information is safe.
Dr. Ellerbeck, from your perspective, anything to add?
Yeah, so I'm just going to riff on that slightly because she mentioned a state messaging, but the messaging can't just come from state government. In fact, there's distrust for a variety of reasons about government messaging. And we need to make sure, first off, that the science is clearly communicated. Our members in the community want to know the science, and that's where things like what you guys have been doing over the past year have just been absolutely critical, laying out that foundation. Being able to provide that scientific messaging in a language and a manner that people can understand. So having people like Mario Castro here who can actually speak in Spanish with concerned members of the Latinx community is critically important. But then it also has to be reinforced, the value and validity of that science has to be reinforced by people from the communities that we're reaching out to. And that's really been the gist of what we've been trying to do with RadX Up, is to try to help empower the voices within local communities. And so Mariana, through her communications team and others, have been actually getting members of the clergy to actually be able to pair up in town hall meetings with the respected scientists to talk about the facts of vaccination, the risks and benefits, and really speak truth.
You know, regardless of the population, and I think almost without exception, we've learned that the messaging is much more impactful when it comes from a trusted local resource. In some communities, that's your physician. In other communities, it's your clergy, and very possibly your community health worker or a trusted source of information, and not so much from, as you mentioned, the state or federal government. Might actually be worse than the state government.
Putting those two together, letting people know that the local community is trusting that scientific voice too. And also having scientists who have a track record of working with our local communities really helps.
For sure. All right, well, Jill, let's get to some questions from the community this morning.
Well, I might as well go right in with the going hot, right? Let's go in hard and hot. Miguel's got a question. From December 14, 2020 to March 29, 2021, There have been reports, he says, of 2,500 deaths among people that have had the vaccine, yet no death has been linked to the vaccine. He said that feels weird. How do you reconcile that?
Well, we actually have a population health expert to help remind us of the fact that people were going to die for a number of reasons: car accidents, heart attacks, strokes, other medical problems, you name it. Whatever the cause of death was, regardless of their temporal relationship to a date they were vaccinated. So that'd be the first thing I would say. But
Well, and I think you hit the nail on the head there. You have to remember who we targeted for these vaccines at the outset. We were really trying to get that vaccine in nursing homes in particular, where we know there's a very high, these are elderly people, many of them very sick,
Yep.
and we were trying to get that vaccine into some of those most high-risk individuals. And you know, when you're vaccinating millions and millions of elderly people, some of them are going to be dying of other causes.
for sure.
Yeah, I mean, I would just like to get into the weeds a little bit on that question is deaths, but does that include our Kansas City area? Is that just Kansas City? I don't, but.
Well, he says CDC, so I'm thinking it's the United States, as reported to, is it VAERS?
Oh, VAERS, yeah.
Yeah.
Yeah, and I think those things need to be reported, but on
You
the
might
other.
explain VAERS too.
VAERS is the Vaccine Adverse Events Reporting System. It's been around for decades, 10 or 20 years now. And then there's a specific one to monitor adverse events from the COVID-19 vaccines, and that is the VSTOP as well. So I think that's good. It's great to report that, but on the flip side of that coin, those reports are also investigated to really determine what is the cause. And really, there has been no determination of cause of death from those. Now, obviously, we have heard about the anaphylaxis reactions. We know that those do occur. Between Moderna and Pfizer, it's about 4.5 episodes of anaphylaxis per million doses given, which again is still lower than, say, the shingles vaccine and their rate of anaphylactic reactions. So, you know, all of those things, I think it's good to report in transparency, and then they're obviously investigated as well. And then we've also heard about some of the blood clotting issues or the prothrombotic state, meaning your risk of blood clot from the vaccines as well, and that is continuing to be investigated and reported on also.
Along that line, Susan wants to know, should I take an aspirin before I get the vaccine to avoid blood clotting?
I'm going to say no, but talk with your medical team or your primary care physician. There's no guidance to do that. There's no recommendation to do that, just because I'm not sure the utility of one baby aspirin. The other thing is we do know that people can go on baby aspirin once a day, but you also have to weigh the risk of your chance of getting a GI bleed, a gastrointestinal bleed in your, in your esophagus, stomach, your colon. So those are risks that you need to weigh. And so I think discussing that with your primary care physician or your medical team is going to be the best thing to do. But I don't see a lot of benefit from getting one dose of a baby aspirin. And again, there's no recommendation to do that at this point.
Okay, Melissa wants to know, any studies of moms who have gotten the vaccine, and are moms in the Latinx, am I saying that right? How do I say that?
That's fine.
All right, are they signing up to get vaccinated?
So I think mothers per se weren't in the initial high-risk group, but now that we've expanded our vaccine recommendations, mothers are certainly doing it. And I think mothers, anybody involved in school-related activities, we would like to start getting more of those people around our children vaccinated until we can actually get the vaccine out to our kids, and it's approved for children under the age of 16.
You know, our obstetrics team is recommending as part of prenatal care that all moms to be get the vaccine, including those that seek care here from the Latinx community. I don't know that I have actually seen any data from our experience as to uptake rates and if they are different. But I know that we are recommending that regardless of concern, and having those conversations, again, as an established healthcare provider with a patient, with a very firm recommendation, as we mentioned, for for those who are pregnant or for moms who have children at home as a form of protection for those kids that are just not yet eligible for the vaccine.
That might be a good question to ask Mariana, too. I mean, what is she hearing among that population?
Yeah, Mariana, do you sense that there is either hesitancy or desire from mothers or moms-to-be in the Latinx community?
Yeah, so we have actually one flyer addressing that, because we have heard a couple of things. One, the fear of pregnant moms. So I'm so glad to hear that you're recommending that in the prenatal care, and would love to develop some more messaging about that. And then the other concern about infertility. Those were two of the most common myths that we were hearing, and develop messaging around that. So I believe it is a concern.
Julia wants to know, is KU offering antibody testing for transplant patients after vaccination, since there are questions about its effectiveness for immune-suppressed patients?
Yeah, that's a great
So I
question.
actually had this conversation
Yeah.
yesterday with a couple members from our team. The question continues to come up. So the antibody testing that we, in our lab, the serology testing that we are currently doing, is not actually to the spike protein.
Yes.
We would not necessarily expect to see a positive antibody test ordered and run in our lab after a vaccination with one of the vaccines, well, I think all of the vaccines that we have presently, who are really targeting, or those vaccines are targeting mostly, if not exclusively, a spike protein sort of antigen. So that doesn't mean that there is not value in testing or that we are not participating. I think there are a number of studies, most recently one that was published in JAMA Network, that does talk about the variation in antibody response, even when it's at a lab that measures antibodies to the spike protein, in those who are immunosuppressed as part of a transplant immunosuppression regimen. So when necessary, we're working with our patients who are in those populations. If there's a good reason to understand, but Dana, you've mentioned a number of times that circulating antibody levels don't tell us the whole story about immunity anyway.
Yeah, no, I think that's a great answer. You know, there was also a recent publication in New England Journal of Medicine looking at transplant patients after a first dose. And up to almost 20% of those didn't have neutralizing antibodies that could be detected from that first dose of vaccine, whether it's Moderna or Pfizer. But I think, you know, we have to understand that, just as you said, it's not all of the antibodies. This question is still being asked. It's still being investigated and answered. We also have T-cell responses as well. And sometimes, depending on what your immunosuppression regimen is, what drugs you're on to decrease your immune system, that can have effects on the T-cell response as well. We know one of our colleagues just wrote us about a family member who had gotten the vaccine and was on an anti-B cell medication called rituximab. So B cells are the cells that make antibodies. When you're treating against those B cells, you really don't have the ability to make antibodies. So in that case, using an outside lab, they did check for spike antibody, and it was negative. So they didn't make antibodies to spike after the vaccine. But again, we still don't know fully about the T-cell response, the other immune system components. So that's a very good question. Right now, we are still trying to answer that. But right now, there is no change in guidance at this point for vaccination, or even really testing after vaccination, whether that's antibodies. And there's no real good commercial test to look at T-cell activity either.
So I guess Susan has a good kind of follow-up question. It's in the same thought stream. She says, how can a person with blood cancer learn if the vaccine was effective? She's read that only 16 to 36%, that it's only 16 to 36% effective in those patients. And I guess I would follow up on Susan's question with, if that in fact is the case, then those people just have to keep doing the pillars of infection control to protect themselves?
Yes. I think no question about the second part, right? How do you keep yourself safe? The same way you kept yourself safe prior to a vaccine, at least over the last year, until we can potentially get to the point where there's enough population immunity or benefit from widespread vaccine that we don't see a lot of disease transmission in our communities, which we know is not the case now. But as far as the efficacy question goes, for specifically for blood cancers, I would even have to qualify that and say those studies have a lot of caveats. It depends on which cancer and where in the treatment cycle and what your treatment cycle is. And so it's impossible for us, I think, to answer but specifically. But Dana, you also talk a lot about your work in preparing transplant patients, for example. Knowing that immune responses might be blunted, similar, not for the same reasons, but similar to some cancers or cancer treatments. Even in those cases, some benefit from a vaccine is better than none. Right?
Yeah. I mean, that's the main goal of that message is the benefit will outweigh the risk because these vaccines are safe. And I know for my transplant population that we look at to give liver transplants to when they have, poorly functioning livers or no functioning liver, sometimes we have to redose them with hepatitis B vaccine 1 or 2 times because they didn't mount a response the first time. We actually sometimes have to double the dose as well. So that's not unheard of. But I think to your point, it does depend on what blood cancer you're talking about. If you are on treatment, where you are in that cycle of treatment. We understand that those populations that are have the cancers have treatment regimens or have had even bone marrow transplant, there is still a protocol, or solid organ transplant, there is a protocol and a time frame to give other common vaccination like influenza vaccination, pneumonia or pneumococcal vaccination as well. But in this case, again, it's not fully answered what happens when you give these vaccines to those populations. But right now, certainly the benefit outweighs the risk. So the answer would be to go ahead and give that in hopes of getting and garnering some sort of immunity.
Would this be a reasonable time to re-invoke the term herd immunity and talk about the idea that if you're suffering from one of these disorders where you might not respond as well to the vaccine, it's important to get your own local herd fully immunized.
Yes.
And it's part of the reason we know, for example, with measles, there's certain people who either don't respond or can't get the measles vaccine. But that's the reason we want all the other kids that are in their herd to be vaccinated to protect them. So it's all of our responsibility to get vaccinated as soon as we can, so that we can protect those who might not respond as well or be more vulnerable.
Absolutely. Absolutely. It's the same conversation around parents at the moment getting vaccines around their children, if they're going to be around their children. You're providing them protection. Even if it's not 100%, it's better than nothing. And there's a really good reason to think about the benefit to your herd, your community, your population, whatever word it is you use.
We're getting vaccinated for the ones we love, too, not just ourselves.
Yes.
Okay, so I know, Dr. Wild, you have a hard stop today. You have to go see patients. So I'm going to give last question, and then we can wrap up. And yes, I do see a lot of questions here, and that'll help me for tomorrow. Now I know what questions we're asking tomorrow, so we'll have to tune in. Carol gets the last question. What advice do you have for people who feel getting vaccinated fruitless because COVID is here to stay, as are the masks? Activities that we knew prior to 3/2020 will never happen again without masks, and we have to exist in smaller numbers. I get that Carol's feeling what she's feeling, but is that true?
Well, I don't think that any of us would agree that a message that this is hopeless should be the message we're sharing to any group for any reason. I think we all recognize that people are ready to move back to doing things in a way maybe that they did 14 or 15 or 16 months ago, and that we're tired in many, if not all respects, of the restrictions on how we interact and move and what we can and can't do safely. My response to that would start with, at least, the only way we're going to get there, the way that we get to less restriction on our lives for whatever reason, as it relates to COVID, of course, is that we really push vaccination. If we don't get there and get there before we end up with a lot of new variants that may not have, or a lot of new variants where the vaccine may not have the same benefit, if we don't do those things, then we're losing our opportunity. to get to a point where there's less restriction. And I know for so many people, this feeling of I can't do what I want, I can't live my life the way I want to is very, very important. And so I would share the message, right? Vaccination is not the only key to getting there, but it is a major part of that plan. On top of that, right, there are constantly questions still about safety and whether the vaccine was brought about too quickly and whether that's a safety risk. And I think we all know that a good portion of the reason that these vaccines got to market, got to arms as quickly as they did was, well, maybe two important ones. One, there had been some study for years on this mRNA sort of vehicle or vector, but more importantly, there was a lot of the normal red tape that goes along with an approval that we really sort of limited, not did away with, and definitely not the safety profile studies or checks. We just did those things more rapidly so we could get these out. So the vaccine is safe. It's an important part to getting to the point where we have less restriction on our life and can do a little bit more. And I definitely don't think we're sharing a message that it's hopeless. And so, I don't know, there's probably a lot more that we need to share there.
Well, I'm sure, to keep it simple, I'm planning some major trips and enjoyment late summer, early fall. My ability to have that enjoyment is going to be dependent upon everybody else getting, a lot more people getting vaccinated. But I'm pretty optimistic that we're going to be able to turn this around.
I think so.
Yeah, I don't think it's a fruitless message. I think that we have faith and hope that we are going to get back closer to 2019 than we were with 2020. We can do this because of compassion and, of course, science, especially during this Holy Week. We can see that a lot of people are going to be able to go to Easter services, and that's important for a lot of groups of people, or maybe even meet with some relatives that they were unable to a year ago. So we are already a light years ahead of where we were because of vaccination. So through vaccination, through right now continuing those public health measures, masking, group size restrictions, and distancing, in addition to the vaccinations, we will be able to get there. We also know that as we vaccinate more and more people and do get towards that population immunity, it will be closer. We know that already the baseball stadiums are going to be letting more people in. Whether you're in restricted states or unrestricted states, things are changing for the better, and we will get there, but it is still going to take time. We still need to continue to do those things, but it is moving in the right direction, and if we continue to have the hope and trust in the science and do what's right, it will be much closer again to 2019 than it was 2020. It's just going to take baby steps, but we are getting there.
I was actually at Kaufman earlier this week, and it felt really, really normal, despite the fact that everyone was in masks. It felt really normal to be having a conversation about 10,000 people being in the stands in a safe way today for opening day. So, today is opening day of a 3-day series at the K. Tomorrow is a day off just before the weekend games, and Dr. Vince Key, the head team physician for the Royals, will join us to talk about COVID-19, spring baseball, what we've learned from last year, and what's new in the sense of what's happening with the team and at the stadium. We'll also have Lance Williamson, our infection prevention and control nurse supervisor, here to help answer questions from the week that we haven't gotten to. So looking forward to that and baseball today. So Dr. Ellerbeck, as we wrap up, any final thoughts today?
I just wanted to really call out the members of our community who really have been devoting countless hours to helping to craft messages to help get the rest of their community members, their colleagues, friends, relatives vaccinated and tested when needed.
Great. Mariana, final thoughts?
Likewise, just very, very thankful for all the support in the 10 different counties from community-based organizations, faith-based organizations, community health workers, and all the people who have been on the trenches and helping us disseminate messaging. A big thank you.
Thank you. Thanks for being here today. Dana?
Yeah, I would certainly echo Mariana's thoughts. We do work hard to give transparent and true messages, and we'd be remiss to say if we didn't mention Truman Medical Center, which has done a great job on the Missouri side in Kansas City, Missouri, but also Wyandotte County, and we know the efforts they've taken for testing and information. We will continue to provide that reasonable information, transparent, accurate, bust some of those myths like the microchips. I think our sign interpreter Michelle said it best when we don't need microchips injected. We all have our phones that are on 24 hours a day that we can't separate from. So, it's just those things. And those are simple messages, but when they come from the community leaders, as we talked about, and the people that are trusted, that's the important thing, and we will continue to try and maintain being a trusted voice with accurate and transparent information.
Absolutely. I've been thinking a lot this week about the very real questions and concerns that have come up around vaccination and will I get it or should I get it? Whether that was our conversation with George, Dana, earlier this week, a patient here, or a number of other conversations where the questions and concerns are very, very real and are definitely not something we would want to discount. And I keep thinking about how do we really convey the message that the science has made us very sure that this is safe and the right thing to do. And maybe one number to throw out there to help reinforce that is over 90% of the physicians in the United States have received their complete vaccination cycle to date. 90%. That wouldn't be the case if any of us felt it was a risk to us or our patients or our families, if it were unsafe or if it didn't work. And so as you grapple with your own questions and concerns, hopefully if you're on the fence, that's just one more point that helps push you to the side of vaccination is right for right now. It's necessary for all of us. And as Dr. Ellerbeck put so well earlier, you don't just get vaccinated for yourself, but you get vaccinated for those that you love. So with that, enjoy baseball today. Be safe out there. We'll see you tomorrow.